Hi, today I'm going to talk about cardiovascular effects of intensive lifestyle intervention in type 2 diabetes. Weight loss is recommended for overweight or obese patients with type 2 diabetes. This recommendation is based on short-term studies showing numerous benefits of weight loss, including improvements in glycemic control, risk factors for cardiovascular disease, quality of life, and other obesity-related coexisting illness. Let's going to see a video about this.
In this animation, we discuss the concept of physical activity and exercise as they relate to obesity. In humans, there is a fine balance between energy intake and energy expenditure. Energy intake is in the form of food, and energy expenditure is in the form of the basal metabolic rate and physical activity. The difference between energy intake and energy expenditure is the net energy balance. If intake exceeds expenditure, then a net positive energy balance occurs. Energy expenditure depends on a number of factors. This includes the starting body weight, the basal metabolic rate, and physical activity. With regard to physical activity, there are several key variables, including the frequency, intensity, duration, and type of activity done. Let us examine energy consumption. One honey-glazed donut is shown, which has approximately 300 kilocalories. The energy intake from the consumed donut is equal to the energy consumed by moderate walking for 30 to 60 minutes at 3 miles per hour. If an individual walks for an hour at 3 miles per hour, they will expend approximately 300 kilocalories, the same as what was contained in the consumed donut. If an individual walks daily for 1 hour at approximately 3 miles per hour, this type of activity would lead to weight loss. This assumes that the individual does not consume any extra calories and has a net negative energy expenditure. If this continues for a period of 2 to 4 months, body weight is reduced as depicted. The initial weight loss is the result of a negative net energy balance. The negative energy balance is because energy expenditure exceeds energy intake. After the initial weight loss, the individual continues to do the same type of exercise, that is, 1 hour of moderate walking daily. The chart depicts changes in body weight over time. Individuals are often frustrated and surprised that the weight is not continuing to decrease despite regular walking. They have reached a plateau. The reason behind the weight loss plateau is that with decreased body weight, the basal metabolic rate also decreases. When the basal metabolic rate decreases, there is a decrease in total energy expenditure. If the discouraged individual quits their daily walking exercise, the weight is gained again, at a quicker pace. The weight is regained as a result of a positive energy balance being created. Energy expenditure is now less since the physical activity has been stopped. By keeping the same intensity and duration of walking without making any changes in the diet, energy intake, the individual would enter a weight maintenance phase. This is characterized by gaining a small amount of weight. The weight maintenance is the result of an energy balance being established within the body, where energy intake essentially equals energy expenditure. If there is no change in energy balance, there will not be any further change in weight. What must be done to end the weight loss plateau? Several options exist to maintain a negative net energy balance. These involve either decreasing energy intake or increasing energy expenditure. Options include restricting calories further, or increasing the frequency, or the intensity, or the duration of the exercise. In summary then, weight loss plateaus are expected and can only end with continued exercise and a net negative energy balance. Stopping exercise or increasing calories will lead to weight gain. If one continues to exercise to maintain a net negative energy balance, weight loss will be promoted.
It is unknown whether weight loss reduces the risk of cardiovascular morbidity and mortality in patients with type 2 diabetes. Epidemiologic studies involving patients with diabetes have had conflicting results, perhaps because of confounding from unintentional weight loss. Overweight or obese adults with type 2 diabetes can lose weight and maintain modest weight loss during a 10-year period. Multi-component lifestyle intervention in clinical trial settings typically achieve an initial weight loss of 7 to 10% with maximum weight loss at 1 year. Let's see more about this.
Hello from the American Diabetes Association 73rd Scientific Sessions, the largest diabetes meeting in the world. I'm Anna Baker in Chicago with more breaking diabetes news and research. For obese people with type 2 diabetes, a long-term intensive lifestyle intervention program focused on weight loss can help in countless ways. However, results from a recent clinical trial reveal that such intervention does not reduce the risk for heart attacks or strokes any more than diabetes support and education. Funded by NIH, this study involved more than 5,000 overweight or obese adults aged 45 to 76 who had been diagnosed with type 2 diabetes. Participants were assigned to one of two interventions: lifestyle, which involved physical activity and weight loss, or diabetes support and education, which involved 3 counseling sessions per year on nutrition, physical activity, and social support. Participants were followed for 11 and a half years, and the primary goal was to see whether the intensive intervention would reduce their risk of cardiovascular disease and death. Participants in the intensive lifestyle intervention group initially lost 8.6% of their body weight and maintained a loss of 6%, which was better than the researchers had expected. But this group did not reduce their risk of cardiovascular disease or death, or their level of LDL cholesterol, which is the so-called bad cholesterol, compared to the support and education group. That group lost 0.7% of their body weight initially and 3.5% by the end of the intervention. Now, there are numerous possible explanations for these results. For example, the comparison group did have greater use of medications to lower their bad cholesterol, so that might have minimized any difference between the groups. And the study cannot rule out the possibility that greater weight loss may have impacted cardiovascular risk. But there is some good news here, because the intensive lifestyle intervention group did experience other benefits, including reducing the risk of kidney disease, retinopathy, and symptoms of depression. Other benefits included a better physical quality of life and lower medical costs by reducing the need for hospitalizations, outpatient care, and medications. Lifestyle intervention also produced a greater reduction in A1C, which is a measure of your blood glucose over the last 2 to 3 months, plus greater improvements in fitness levels and risk factors for cardiovascular disease, all except LDL cholesterol. So what this new research tells us is that overweight and obese adults with type 2 diabetes can and should lose weight to reap many important health benefits, even if a lower risk for heart attacks and stroke may not be among them. I'm Anna Baker with breaking news from the American Diabetes Association's Scientific Sessions in Chicago. To view this press release online, please visit the For Media section of our website, diabetes.org, and for the latest video coverage of the meeting, stay tuned to diabetes.org/breaking news.
An intensive lifestyle intervention focusing on weight loss did not reduce the rate of cardiovascular events in overweight or obese adults with type 2 diabetes. Let's see the last video. This is a nutrition video to help you to
Nuts, wheat germ, garlic, fruits,
know how to
and
eat
vegetables
better.
are rich in them. A vegetarian regimen should be followed, as all the vegetable origin foods are free from cholesterol. Foods to avoid: commercial cheese, cheese spread, cream, butter, ghee, oil, lard, vanaspati, and margarine. Organ meats like liver, heart, kidney, and brain. Seafoods like shellfishes, oysters, lobsters, shrimps, crab, and prawns. Fatty meats like sausages, bacon, ham, salami, pork. Egg yolk and all preparations containing egg yolks like cake, pastries, desserts, puddings, and custards. Concentrated milk preparations. Avoid nuts and oil seeds like ground nuts, coconuts, walnut, cashew nut, almonds, and sesame seeds, etc. Use of saturated fats like butter, ghee, and others mentioned above are to be avoided as these fats increase the blood cholesterol. Instead, vegetable oils rich in polyunsaturated fatty acids, or PUFA, are to be used in limited amounts. The oils in decreasing order of PUFA contents: safflower oil, sunflower oil, soybean oil, corn oil, rice bran oil, cottonseed oil, groundnut oil, palm oil, coconut oil. Use non-stick pans or Teflon-coated vessels for cooking to reduce the amount of cooking oil. Fiber content of the diet should be increased as it helps to lower the cholesterol. It can be increased by the following ways. Use whole wheat flour instead of refined flour and bread. Avoid pasta, noodles, etc. Use dals and pulses with their skin. Have plenty of fresh fruits instead of fruit juices. Eat whole fruit with the skin if possible, for example apple, chiku, etc., and with the seeds if possible like in guava, etc. Have plenty of raw vegetables, salads, and dark green leafy vegetables. To avoid flatulence, the intake of fiber should be increased gradually with the intake of sufficient fluids, at least 8 to 10 glasses of water per day.